let's talk about the secret side of new motherhood. The wince when you try to sit down, the moment of dread before you use the bathroom, the feeling that you're dealing with something painful, embarrassing, and that you're completely alone. I'm talking about postpartum hemorrhoids. If you know exactly what I mean, I want you to hear this. You are not alone. My name is Dr. Sarah Collins. I'm a medical scientist, and today we are breaking the silence. This isn't just a medical brief. This is your complete survival guide. We're going to cover the why, the what to do right now, and how to make it better for good. So let's get started. So, why does this happen? Why, on top of everything else, do you have to deal with this? In short, pregnancy creates the perfect storm for hemorrhoids. A hemorrhoid is simply a swollen vein in your lower rectum and anus. There are two types. External ones are the painful bumps you can feel on the outside, while internal ones are further inside, and you might only know they're there from bleeding during a bowel movement. There are three main culprits that team up during pregnancy. First, the sheer pressure. As your baby grows, your uterus expands, putting a tremendous amount of weight on the pelvic floor. It's like standing on a garden hose. The pressure causes blood to back up and pool, causing the veins down below to swell and bulge. Second, hormones and blood. Pregnancy is a hormonal marathon. Key hormones like progesterone and relaxin are essential for your pregnancy, but they also relax the walls of your veins, making them stretchier and more prone to swelling. At the same time, your total blood volume increases by as much as 50% to support your baby. So you have more blood flowing through weaker, more relaxed veins that are under constant pressure. It's a guaranteed recipe for hemorrhoids. And third, constipation. Those same pregnancy hormones also slow down your entire digestive tract. This leads to constipation, which is incredibly common. When you're constipated, you're more likely to strain on the toilet. And that intense straining is a major direct cause of hemorrhoids. Then comes the main event, childbirth. The sheer force and pressure of pushing during a vaginal delivery is, for many, the final trigger that causes hemorrhoids to appear or worsen dramatically. It's a monumental physical event, and your pelvic floor is at the epicenter. All right, that's the why. Now, for the most important part, what can you do for relief right now? I call this the Postpartum Survival Kit. First, the Sitz bath. This is your new best friend. A Sitz bath is a shallow basin that fits over your toilet. You fill it with warm water and simply sit for 15 to 20 minutes. The warmth is incredibly soothing, cleanses the area without friction, reduces itching, and increases blood flow to promote healing. You can also consider adding Epsom salts, which can further soothe muscles, but check with your provider first, especially if you have stitches. Do this 2 to 3 times a day, especially after a bowel movement. Second, cooling and astringent pads. Pads medicated with witch hazel are a lifesaver. Witch hazel is a natural astringent, helping to shrink swollen tissue and reduce inflammation. For extra relief, keep them in the refrigerator. The cooling effect is immediate and provides wonderful relief from burning and itching. You can gently pat the area or even fold one up and leave it in place against the skin for a while. Third is smart hygiene. The golden rule is pat, don't wipe. Rough toilet paper is your enemy. Use a peri bottle, that little squirt bottle from the hospital, to rinse yourself with warm water after using the toilet. Then gently pat dry with soft, unscented toilet paper or a soft cloth. This isn't just about comfort, it's about preventing tiny microabrasions from rough paper that can worsen irritation and delay healing. Fourth, the donut cushion. Sitting can be agony. A donut-shaped cushion takes the pressure directly off your rectum when you sit. Use it everywhere, in the car, at the dinner table, on the couch. It makes a world of difference. Finally, there is over-the-counter help. Many creams and suppositories contain ingredients like hydrocortisone to reduce swelling, or a local anesthetic like lidocaine to numb the pain. But, and this is critical, if you are breastfeeding, you must speak with your doctor or pharmacist before using any medicated product. Always, always confirm first. Those tips are your lifeline. But the real healing and the way to prevent future issues is in your daily habits. First, you must defeat constipation. Fiber is your greatest ally. Aim for 25 to 35 grams per day. You need a mix of soluble fiber from things like oats, beans, and apples, which forms a soft gel, and insoluble fiber from whole grains and vegetables, which adds bulk. You need both for the perfect, easy-to-pass stool. All that fiber needs water to work. If you don't drink enough, fiber can make you more constipated. Aim for 8 to 10 glasses of water a day, and even more if you're breastfeeding. If diet isn't enough, a gentle fiber supplement like psyllium husk can be a huge help, but talk to your doctor first. Second, completely rethink your bathroom habits. Go when you feel the urge, don't hold it in. Most importantly, do not strain. If nothing happens after a minute or two, get up, walk around, and try again later, and elevate your feet. Placing your feet on a small stool while on the toilet is a true game changer. This posture relaxes a muscle called the puborectalis, which essentially unkinks your colon. It creates a straighter pathway for stool to exit, meaning you don't have to push nearly as hard. It's the single most effective mechanical change you can make. Third, gentle movement. Once you're cleared for light activity, start walking. Just 20 minutes a day stimulates your bowels, improves circulation, and accelerates healing. For most women, postpartum hemorrhoids are a temporary condition that will improve dramatically with this care. However, there are red flags that mean you need to call your doctor. Call them if bleeding is significant. A little spotting on the paper is common, but more than a small amount of blood in the toilet bowl warrants a call. Call if the pain is severe and getting worse. This could be a thrombosed hemorrhoid, where a blood clot has formed. It's not dangerous, but it can be excruciating and may require a simple procedure. Also make the call if a lump feels hard and you can't gently push it back in, or if you have any signs of infection like a fever. Please do not let embarrassment stop you. Your healthcare providers have seen it all. We are here to help you. Your well-being matters. The journey into motherhood is a profound transformation. Your body has performed a miracle. These postpartum challenges aren't a failing on your part. They are battle scars from that miracle. Be gentle with yourself. Give your body the same care and patience you give to your new baby. Follow the survival guide. Soothe, cool, sit smart, and tackle constipation head-on. And most importantly, speak up and ask for help when you need it. You are a mother. You are strong. This discomfort will pass, and you will be left with the joy that makes it all worthwhile. If this guide was helpful, please share it with another mom who might need this. And in the comments, let's break the taboo. Share one thing that helped your recovery. Let's build a community of support. Take care of yourselves. You deserve it.